Hi, my name is Anna Langston. I'm a nursing student and I'm going to be doing my medication administration checkoff. So first I'm going to do is I'm going to show you my badge. I'm going to show my surrounding area. Okay, now I'm going to be going into the med room and I'm going to be getting ready my medications. So first what I'm going to do is I'm going to make sure the door is shut, making sure there aren't any distractions or any colleagues talking to me at this time, and I'm not on the phone. So first what I'm going to do is I'm going to perform hand hygiene. I'm going to be first looking at my patient care order form and my MAR. So first what I'm going to do is look at my patient's name. So my patient's name is Jaguar J. Jones, Jaguar J. Jones. The MR, which is 417-6352, 417-6352. My patient is allergic to penicillin. I see that we're allergic to penicillin. And then now for the medication that's ordered, which is the Novolin R regular insulin, Novolin R regular insulin, U100, 10 units subcutaneously 30 minutes before a meal. And then the right indication is that the patient's blood glucose is okay to give insulin, and then I don't have any documentation at this time. So now what I'm going to do is I've confirmed that the medication order is correct, so I don't need my patient care order form anymore, so I'm going to put that to the side. So now what I'm going to do is I'm going to be getting ready my medication. So first what I'm going to do is I'm going to perform hand hygiene. I'm going to make sure I have the right patient, Jaguar J. Jones, MR number 417-6352. We're allergic to penicillin. So I'm going to be getting Novolin R, which is regular insulin, U100 insulin. So I've got my Novolin R, regular insulin, U100. And also I'm going to note the expiration, which is 12/1/2025. And then also I'm going to verify with another nurse that I have the right medication. And the patient is getting U100 insulin, 10 units. So I've got my insulin syringe. And I'm going to be giving 10 units for the patient. So I have the right syringe. And now what I'm going to do is I'm going to pull up my medication. So first I'm going to clean with an alcohol wipe. And I'm going to be pulling up 10 units of air. Inserting 10 units of air into the syringe. Flipping my vial and pulling up 10 units, making sure I don't have any bubbles. And if I do, I just need to flick those out. Okay, I pulled up 10 units. Now I'm going to do, when I recap first I'm going to do is I'm going to show you my insulin. Make sure I have 10 units. And I'm going to recap my syringe. I'm going to do the scoop technique. Okay, so I've got this on. So I've got the right amount pulled up. So it's subcutaneously 30 minutes before a meal. So I got to make sure it's the right time. The patient hasn't had anything to eat yet. And the right indication is that the blood glucose is okay to give insulin, and I don't have any documentation to do it this time. So now I'm going to do is I'm going to do my second check off, which is I'm going to make a label. And on the label, I'm first going to do is I'm going to write the patient's name, which is Jaguar Jones. And then the right medication, which is Novolin R. I pulled up 10 units of Novolin R, 10 units, Novolin R. Okay, now that I have that written down, I'm also make sure the right indication or the right time is 30 minutes before a meal. It's given subcutaneously, and the right indication is that the blood glucose is okay within normal. Is it okay to give insulin? And I don't have any documentation to do, so I'm going to put this on my syringe. So I've got my 10 units of insulin pulled up. I've made sure I've got the right medication, so I don't need my medication anymore. So I've got my MAR and my medication. So now I'm gonna do is I'm gonna go into the patient's room. I'm gonna give the medication. Go into the patient's room. Okay. So I'm gonna knock on the door. Hey, Mr. Jones, my name is Anna. I'm gonna be your nurse, and I'm giving your insulin medication right now. So what I'm gonna do first, I'm gonna perform hand hygiene. I'm going to put on my goggles. I'm going to put on a clean pair of gloves. Okay, so now what I'm going to be doing is going to make sure I have the right patient. So I'm going to look at the patient's armband. So for my armband I have on the patient, which is Jaguar J. Jones, I'm going to compare with the MAR, Jaguar J. Jones, 4176352, 4176352. I note that the patient is allergic to penicillin. We're allergic to penicillin. And then I've looked at my armband. So then I'm going to ask the patient, do you have any other unknown allergies we need to know about? Okay, great. No? So the patient doesn't have any other allergies. And then also what I'm going to do is any other pre-assessments that the patient needs to have done before getting the medication. So for this patient, we need just to make sure that our glucose is okay to give the insulin. And then any other pre-assessments and making sure the patient hasn't had anything to eat. So what I'm going to do is I'm going to go to the patient, I'm going to lower the side rail, and then raise the bed to a working condition height while giving the patient privacy. And for this, I'm going to be giving the injection on the abdomen area. So giving the patient privacy while moving their gown and the blanket. So first, before I give the medication, I'm going to make sure one more time do my last check off. So I have Jaguar J. Jones, Jaguar J. Jones, Novolin R insulin, and it's a U100. We're getting 10 units subcutaneously, 30 minutes before a meal. I make sure we haven't had anything to eat, the right indication, which is the blood glucose, and then I'm not doing any documentation at this time. Okay. So now that I've got the patient adjusted, I'm going to be putting on the abdomen area, which is a U shape kind of below the 2-inch margin of the umbilicus, not going past on the sides the anterior superior iliac spine, and then not going above the costal margin or below the pubic area. So what I'm going to be doing is I'm going to go to my injection site. I'm going to be cleaning with an alcohol wipe, doing it in a circular motion. And I've got my medication. I'm going to be pinching the skin, putting the needle in. I'm not going to aspirate since this is a subcutaneous shot for insulin. I've got the medication in. I'm going to put pressure on it. I'm going to put my needle in the sharps container. I hold pressure. Okay, I'm done. So now I'm going to make sure my patient hasn't had an allergic reaction or anything. Then I'm going to give my patient privacy while raising the rail and then lowering the bed to the lowest position possible. Now that I've done that, what I'm going to do is I'm going to take my gloves off. I'm going to perform hand hygiene, and then my patient's good. So now what I'm going to do is I'm going to take my MAR back to the nurse's station doing documentation. So I'm going to do the 7 rights. I'm also going to come back in 30 minutes and making sure, my patient has gotten something to eat, and then also that my patient has any assessments for giving the insulin. And then writing the 7 rights, and that is it for my medication administration checkoff. My second